Hello. Welcome to another Y107 MU Healthcare Ask the Expert podcast. My name is Cosmo, morning show host on Y107, and joining me, MU Healthcare Sports Medicine Dr. Clayton Nuelle. As the weather warming up, we're getting more active. We're out and about on the trails. We're running, we're biking and hiking, and we're talking some important info if you're stiff or sore or swollen. Doctor, let's start things off here with just a simple question. What are some of the most common injuries that you and your colleagues see in the springtime?
Well, as the weather gets warmer, that means everybody's trying to get outside and get outside as much as they can. That can mean running, playing golf, tennis, baseball, those types of things. The most common injuries we typically see as people start ramping up those activities again are overuse injuries. And so that's usually muscle strains or ligament sprains or overuse injuries such as tendinitis. Oftentimes when runners start to get going again, they start to get some tendinitis in their feet or their ankles. Baseball and tennis players or golfers get elbow tendinitis or wrist tendinitis. So the biggest advice that we give to people is usually to try and ramp up slowly. Don't go out and try and play 36 holes on the first sunny weekend that we have here in March or April. Ramp up slowly and kind of go back to those activities a little bit slowly but surely. And then as you get outside and start doing more lifting or start trying to move stuff or do your spring cleaning, we see a lot of back injuries, back strains, and those types of things. So again, try and do some of those activities slowly and make sure you lift with your legs and do things slowly and methodically instead of just jumping right back into it or lifting too heavy too soon and injuring something.
You know, a lot of us are getting active, right? You're a little sore, you feel tired now. How can we tell if it's serious enough that we might need to go see a doctor?
That's a great question. So initial pain or soreness is something that's very common, particularly as we all start getting outside or start to ramp up our activity. But persistent pain, and in particular persistent swelling, are things that can be a little bit more concerning. And if you have persistent pain or persistent swelling, or if your joint starts locking up or feels unstable, or you have inability to move your arm or your leg, or inability to stand or walk, those are things that are a little bit more concerning and probably should seek out the advice of a physician or someone like that to try and evaluate that further.
One of the more common issues right now, like runners especially or athletes, you do the same motion over and over, stress fracture. What are some of the signs or symptoms of that injury specifically?
So typically the signs and symptoms of a stress fracture are persistent pain, particularly focal or localized pain in one area, whether it be a joint or one spot on the bone. A stress fracture is a small crack or a small break in the bone, and it's typically caused from repetitive use or overuse. And very often we see it in runners, particularly runners who get back outside and run long distances, and particularly potentially run long distances when they haven't done so in a long period of time, and then they get that overuse of the knee or the foot or the ankle in particular. So a stress fracture or a stress injury it can be a result of that. And if you have persistent pain and or swelling despite relative rest or despite taking some time off from the activity that caused it, that may be an indication to see a physician.
The Missouri Orthopedic Institute's Sports Medicine Injury Clinic. It's open weekdays, 7 to 8 a.m., no appointment necessary. For more info, go to muhealth.org/sports injury clinic or call 573-882-BONE. Our MU Healthcare Ask the Expert podcast continues with sports medicine Dr. Clayton Nuelle. Again, the weather getting nicer, running, walking, biking, hiking on the trails. We've got so much beautiful parks and everything here in mid-Missouri. If someone is starting to feel a little knee pain, is that normal?
It can be normal. Knee pain is very common, particularly as we all start to ramp up our activities and get outside. Knee pain can be a sign of something as simple as a sprain or a strain or even early arthritis. If you have significant swelling or significant pain that doesn't slow down or doesn't relent with rest, or when you stop the activity, that can be a concern. But in general, some knee soreness or some knee aching is a very common thing when patients start getting back outside or as we start to ramp up our activity in the springtime.
If you end up with a swollen knee or an ankle, what's the best rule for seeking treatment on that injury?
The best rule of thumb for a swollen joint is the acronym RICE. RICE, and that stands for rest, ice, compression, and elevation. So the simplest thing is a short period of rest, ice it if you need to a little bit, elevate it, compress it with something as simple as a wrap or a sleeve, and then in addition to the RICE method, pain relievers such as Tylenol or ibuprofen can help with immediate pain and swelling as well.
The Missouri Orthopedic Institute's Sports Medicine Injury Clinic. It's open weekdays, 7 to 8 a.m., no appointment necessary. For more info, go to muhealth.org/. That's 573-882-BONE. Again, Dr. Nuelle, thank you so much for your time. And that's another Ask the Expert podcast with Y107 and MU Healthcare.